Without delay, I will introduce the next speaker, who is Mathias Nielsen. So Mathias is an associate professor at the Department of Sociology in Copenhagen, Denmark. He is a sociologist by training and holds a PhD in social science from Aarhus University. His research focuses on social stratification and diversity in science, including how gender diversity is linked to knowledge outcomes. Mathias Nielsen was recently a part of the European Commission's Gendered Innovations 2 expert group. I would like you to warmly welcome Mathias. Mathias, the floor is yours.
Thanks so much for the invite. And thanks so much for all of the interesting and thought-provoking talks today. I've really enjoyed it all. So in my presentation, I will focus on diversity and inequality in the scientific system. And specifically, I'll attempt to highlight 2 points that I believe are central to the discussion of diversity in science and to the theme of this panel, which is how diversity can improve research outcomes. And the first one here is the relationship between demographic diversity or demographic representation and the relevance of the scientific knowledge being produced, something that's already been touched upon a few times during the sessions. And the main argument will be here that demographic diversity, by mobilizing a broader array of different experiences and viewpoints, can improve the relevance of scientific research. So the second point relates more to a trend I've started to think a lot about recently, which is sort of the increasing concentration of influence, increasing a concentration of resources on specific individuals within the science system. And I'll try to sort of make the case, or at least ask the question, whether this is something that will reduce the ideas available and maybe even stall fields in moving forward in the long run. So let me start by briefly describing my methodological approach. So as a sociologist of science, I at least primarily draw on various types of data derived from scientific documents, and this includes PhD dissertations, metadata from bibliographic databases, and full-text data from PDF files. And much of my work involves systematizing and parsing these data to gain new insights into researchers' publication careers, mobility patterns, collaborative relationships, and the kinds of topics and methods they work on, and how they build also on each other's work through citations. I'll try to adjust the size a little, the height a little. So the examples I will draw on today is not only my own work, some of it, but also others' work in this domain. So let's now turn to the question of relevance and representation in science. And as I said, I'm here specifically interested in what demographic composition, how that may matter for the sort of methods and questions that are addressed in the scientific system. And my first example concerns something that Dana was talking about earlier today, sex and gender analysis in medical research, and specifically in disease-specific medical research. And as we've already discussed a little bit, historically, medical research has tended to conceive, in the long perspective at least, of the male body as the norm, and as sort of the universal criteria for making inferences about the body, and has overlooked social and biological variations related to what we would call sort of sociocultural gender and biological sex. And this lack of attention can, at least for some types of research questions, disease areas, undermine the validity and precision and relevance of the medical knowledge. And you probably know some of the classic examples of this. The first sort of famous example is between 1997 and 2000, 8 of the 10 medical drugs withdrawn from the American market posed greater health threats for women than for men. And also the famous example about Ambien, although it's been sort of a little bit controversial about whether this is really a good example of gender and sex-related differences. But 10 years ago, the US Food and Drug Administration sort of decided to halve the recommended dosage of Ambien for women. And part of the discussion here is something about body sizes and how much you need of this drug to sort of actually wake up the next day and function readily. Another question is about the metabolization of the drug that's been argued to differ for women and men, and that this led to a higher frequency of women experiencing next morning drowsiness as a result of the drug, leading to traffic accidents potentially. So these are sort of classic examples of the importance of taking into account sex and gender and variabilities related to these categories in medical, disease-specific medical research. Nevertheless, the lack of attention to this question continues to be an issue. In 2020, we carried out a study that examined attention to sex and gender analysis in COVID-19 medical trials. And as you may remember, early in the pandemic, it became clear that there are possible gender and sex-related differences in infection rates, in disease progression, and also in mortality rates. And despite this, when we looked into the American clinical trials registered in the US, only 4% of the more than 4,000 trials really sort of had explicit plans to integrate a perspective on examining sex or gender as variables in their studies. And of course, this can be something people are not pre-registering. But if we looked at the published trials at that point in the biggest medical journals, 8 out of 45 pharmacological trials really reported anything on this at this point, which illustrates a sort of consistent lack of attention to the matter. So why am I giving you these examples? Well, in 2017, we attempted to look at sort of the two classic, at least in Europe, dimensions sort of when we think about gender policies. The European Union have been promoting the representation in the system and integrating a gender dimension into research. So we're interested in what's the connection between the two here, which is often presumed to be connected. So what we did was to look at disease-specific medical research based on the PubMed database from 2008 and onwards for some years, millions of studies, and we tried to, based on the data available in PubMed, to examine how the gender composition of medical teams correlates with the likelihood of integrating gender or sex as analytical variables in the studies. And our models here attempted to account for not only the variation stratification-wise in terms of women and men's representation across fields, but also within fields. We have specific diseases where we see variations, and also across countries. So we try to take into account some of the variabilities that might contribute to this. But we see in this study a clear correlation between women's presence in the author team and the likelihood within these disease-specific areas of integrating gender and sex analysis as a relevant perspective. And this trend was particularly strong when women took on the leading positions as first and last author. So here we have a somewhat narrow, but still I think illuminating example of how demographic representation might increase the relevance of medical research. And this point was also recently supported by another study published in Science, which used methods similar to ours to sort of look at patent and developments and patents in the medical area. And they showed that female patent developers in medicine are substantially more likely to develop technological and medical solutions that are sort of specifically addressing women's health needs. And historically, this has been a clearly underemphasized area, given the relatively low proportion also of female patent developers overall. And what they conclude here in this paper, based on these rough sort of back-of-the-envelope calculations, is that if we had seen an equal representation of male and female patent developers between 1976 and 2010, there would have been 6,500 more sort of female-focused inventions than we see today. And so what, you might ask? Well, here's an image from a medical department at a university that I was working at, and I came across while I was working there. Here you can meet the faculty and you can meet the staff, and I think the picture speaks a little bit for itself. If demographic representation is really correlated with sort of relevance to some extent, there are still challenges, at least within some areas of medicine, especially at the highest academic ranks. So my second empirical example here concerns the field of history, and here I'll adopt a more longitudinal perspective on the relationship between changes in the composition of the field of history and the questions and topics addressed by US academic historians over time. And specifically, this study was based on topic models, digital text analysis of a large corpus of history articles from American history journals since the 1950s, full text articles, and then also American PhD dissertations, all of them since the 1980s in the US. And in this analysis, we show that as women entered the previously male-dominated field of history, the diversity of research topic expanded. The figure you see here is cross-sectional, and it doesn't really detail the historical evolution of topics, but instead it illustrates some of the both overlap, which is also important to acknowledge. There's a lot of overlap in research interest here, but also the variations. For instance, women have been very active within topics such as consumption and consumerism, body history, and sexuality, to mention a few. And here's an example of the concrete developments within family history from the 1970s and onwards. If we look at the left plot here, you see a substantial increase in the prevalence of the family topic. And if you look at the coloring, women have really pioneered research in this area. And if we look at subtopics such as household history and child history, in some of the other plots over here, you can see that some of these fields barely existed before women started entering the field. And we're not talking about clear causality here. It might be as interesting to think about that new fields open new opportunities for new demographic groups to enter science, right? So be careful about thinking about it directly causally. But it's not only a question also about new topics arising, it might also be about changing existing topics. And we have sort of a more qualitative example here of the topic of military history in the US, where we can see that within that topic, as women entered and started to focusing on that topic, we start to see new questions about war being addressed, right? So new kind of questions being raised about the history of war. So to briefly summarize this first part of my talk, my point here is not, and I think that's important, to essentialize these variations. I think they reflect a lot of sociality, these variations, and that's how they should be interpreted. My point is to argue that diverse research system can generate a broader sort of array of different perspectives and ideas, which may better reflect and address the societal needs to some extent. And in this latter example of history, I would say that it's really a question of whose history is being told and becomes part of a sort of shared understanding of ourselves as society. So, but what about other types of diversity? I think gender diversity is a telling example, but my points also have broader relevance, and they could encompass also, for instance, political orientation or class background, to name a few examples. There's an interesting study published a couple of years ago that looked at people of different political leanings and how bringing them together can improve the precision of knowledge dissemination online. So what they did was to look at content moderators on Wikipedia, and they started to look into their political leanings of these moderators. And what they found was that posts on Wikipedia that had been moderated by people with different sort of leanings actually were more precise, more accurate in their account of, for instance, historical events, than the more sort of the post only being moderated by one group that's leaning one direction, you can say. In another, and I think that's a very interesting new study, some economists from Denmark used the Danish register data. We have information on the health of all citizens from their born and sort of their jobs, a lot of information on all citizens, and they used this data to demonstrate how medical doctors' socioeconomic background can be crucial for the patient's mortality and disease progression. So specifically what they showed here is that patients from lower socioeconomic backgrounds, they fare better health-wise in the Danish health system when they are treated by doctors that come from similar socioeconomic backgrounds. So once again, we see a sort of clear and substantial connection between demographic representation that has an importance for the systems as a whole. Finally, to return to science, diversity in schools of thought within scientific fields can also be beneficial. There was a recent study that pointed to that centralized communities, those are the communities in science that are characterized by a stronger homogeneity, a stronger similarity in methods, and where we have authors that occur across different teams in the community. So we have sort of a repetition of authors. They tend to publish less replicable work, less reliable work than some of the communities that are less centralized, where we have more different perspectives and methods employed to the same questions, and where we have independent groups that are competing more on addressing these questions, to return to the previous talk. So on these notes on other perspectives, I want to sort of briefly move to the second shorter point of my presentation, which concerns this question of concentration in the scientific system and the potential narrowing of ideas and perspectives. And my key argument here concerns that how the increased concentration of resources and recognition on certain individuals within the system can create potentially undesirable imbalances in the types of questions, the types of topics that are being addressed. And my first example here comes from a recent study where we used the entire Web of Science database to map large-scale developments in citation concentration at the individual level over time. And in this study, based on field normalized citation that allow us to really compare citation rates across fields, because they vary a lot in practices, we showed that citation inequality has increased significantly during the past couple of decades. So between the early 2000 and 2015, the top 1% most cited researchers expanded their annual share of all citations given from 14 to 21%. So this is around a relative increase of 50% in how many citations they accrue, right, in the system annually. And looking more closely at this concentration with these curves here on the left, we can see that the top 0.1% top cited scientists attracted greater shares of citation than the bottom 38% in the earliest period that we look at, and more than the 47% least cited researchers in the latest period we look at in the study. And if we look at the Gini coefficients, we can see they're also increasing and are considerably higher than, for instance, the global wealth inequalities if we measure those based on Gini coefficients. So, similarly, a number of recent studies suggest increasing funding concentration at the individual level, and I think this will also be correlated with the citation concentration. So funding is, in other words, sort of handed out in larger portions for the same successful individuals. And in Denmark, for instance, a small group of around 10 to 15% of researchers attract between 70 and 90% of all funding. A side note would be, you might guess that there are not very many women among those in that group that attract most of the funding. But the question here is that we have some example of a trend towards a given group attracting more resources that can establish larger labs, right, that has more influence to some extent, and therefore can define which ideas we're pursuing in science. And it raises some questions about, do we have the necessary space for new entrants in this field to raise new questions, to approach things in new ways? At least that's what I think an important discussion to start having based on some of these developments. And I think another point that some might make is that, is the system becoming overcrowded? Is it really some fields, some areas are so overcrowded now that it's stalling the development of the areas? And I think to sort of end with another example, a new study suggests that it may sort of be both and to some extent. Based on also bibliometric data, they show that researchers in very densely populated research fields, so those are the areas where many papers are published annually, papers in those areas, they find it harder to really become cited unless they build on pre-existing canonical papers in the area, right? So it's more difficult to get acknowledged for a new idea in these like heavily crowded fields. And the point here is that we do not only see sort of a Matthew effect at the individual level, but also at the paper level, and that will stall the development of these hype fields where a lot of money is channeled into the same fields. And this raises again some questions about whether we need policies that might attempt to sort of redistribute some of the resources to ensure that we don't have these overcrowded situations. And although this second point is not directly linked to demographic diversity, I think it's really relevant for that as well, because some of the areas that are prioritized and some of the ways this concentration happens clearly have some sort of diversity-related implications in terms of who's funded and who's able to establish a new group and so on. So those were my points. Thanks so much for your attention.